listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health Systems. Today, Brad and I are broadcasting from our administrative offices, and our special guests are AultCare Dietitians, Joy Benjamin and Tori Hargett. Good morning and welcome to the show. We would like to remind our listeners today that today's program is also available on our podcast.
Good morning. Thank you for having us this morning.
Good morning.
You can download our program from the App Store on your mobile phone or any in the past. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime, and we have been on the air. So good morning, Joy. Joy, tell us a little bit about yourself.
Well, good morning, Brad. I am currently a dietitian at AultCare in the wellness department. Historically, I've been through most clinical roles, I would say. I started off at the Altman Hospital and moved into AultCare Wellness. But prior to that, I was a consultant dietitian working in nursing homes, group home settings, and in hospital setting. And I did my undergraduate degree at Bowling Green State University, and I performed an internship, a community-based internship in Pittsburgh, Pennsylvania, which was quite an extraordinary experience to try to maneuver around the city of Pittsburgh. But that is really where I've been a dietitian now for about 24 years.
Great. And Tori, good morning. Tell us about yourself.
So I'm also a wellness dietitian with AultCare and a health coach. I'm a newer dietitian. I've only been a dietitian for just over a year. Prior to that, I went to Kent State for my dual bachelor's degree in exercise and nutrition. And I graduated from the University of Utah with a master's in nutrition. So my experience is very limited. I have some experience with the VA Medical Center, as well as wellness centers, both in Utah and in Ohio. And then I've done some work with the military out in Utah.
So you are from Utah, correct? No.
No, I'm actually from Ohio. I just moved out there for 2 years.
Oh, okay. Interesting.
All right. Well, Joy, why don't you tell our listeners about your experience as a dietitian? You mentioned some of your background, but let's talk about your role with AultCare and how you help patients.
Sure. Well, currently, as a dietitian, I'm also a personal trainer and a certified life coach with AultCare. And so my role is to do a lot of education, a lot of sharing of resources and encouraging and trying to help members really just get a handle on health risks that they might be having and navigate ways that they can maybe focus better on healthy habits. We go out into companies that have AultCare insurance and have our wellness program. We visit those companies and we kind of set up one-on-one sessions with those individuals, typically on a monthly basis. The dietitian's job is to obviously bring in information that focuses on nutrition-focused aspects of their life that they can start to maybe make some changes in, hopefully learn a little bit more about how that impacts whether they have a chronic condition or whether they have risk factors or whether they're doing well and we just want to kind of keep things in balance.
Okay. And Tori, how about your background and your role at AultCare?
So with AultCare, I am assigned to different companies. So I work directly with specific companies, and then I help out Joy and our other dietitian by going to our nurses' companies. But I am on site at these companies on a monthly basis, and I do a lot of nutrition consults, so one-on-one sessions with them. But periodically I pick nutrition topics that I think it's a good group presentation. And so to get more conversation, I'll pick specific topics to do a group presentation.
So both of you focus on kind of the overall nutrition picture, but you probably also support patients with particular disease states that need extra support, I would guess.
Absolutely. Absolutely.
Okay. Well, March is National Nutrition Month. What is the focus for this year as far as patient education goes?
So the theme for this year is Beyond the Table. So really focusing and encouraging our communities to um, focus on the farm to fork table or aspect, shopping local.
In your programs, do you ask the people in the room what did you eat today, or do you listen to what some of the diets of these people are? What is the worst diet you ever heard, or something along that line?
We actually have several stories we could fill this day up with, but we always do introduce ourselves and first ask them what questions they have for us. And as they have questions, we sort of start digging into what their needs are, what their concerns are. And always the conversation leads to, what is your common diet like in a day? We kind of go through each meal. But I would say probably one of the worst I saw was a young man, and he walked into the office with a Mountain Dew 2-liter tied to his waistline. And when I saw the condition of his teeth, I realized he had been on this Mountain Dew for quite some time, and he hadn't had a drink of water in over 2 years.
Oh my God.
I can honestly say that one made an impact. I'll never forget it.
Jeez. Oh God, that is wild.
It is. It is.
Okay.
And I've had a gentleman who told me that he essentially eats from the gas station every day of his life.
Oh gosh.
Those are my 2 worst.
What I've just heard of a lady told me her sister eats at the dollar stores. You know, the dollar stores do have frozen burgers or something in the back of the screen. That's all she eats. You know, thinking, okay, now that's got to be real nutrition.
You wonder how she feels physically.
I know.
You know, just to comment on that too, but sometimes I think people don't really realize what the right way is to eat. So I'm quite sure your message is valuable. And I think sometimes in healthcare, we might take terms for granted. We had a patient in the pharmacy a couple weeks ago who came in and said, you know, I just came from my doctor and they told me to get more protein. And they're like, is like beef jerky protein? Because I don't know what protein is. So I think we got to be careful sometimes the terms we use and not take it for granted. So
You're exactly right.
We do sell a lot of beef jerky. We do. Okay. So Joy, what is farm to table?
Farm to table is really a concept that was born well before I was around, but the concept here is really just trying our best to get food literally from the farm to your home without the level of distribution, if you will. So kind of cutting down on the middleman. Ideally, we would love to see more local restaurants and grocery stores focusing on getting produce and product essentially from our local farms rather than larger distribution centers and the miles that are traveled. So that's the concept in Farm to Table, just really doing our best to focus on local.
Interesting. And you know, you are right. I mean, a lot of the big groceries, the stuff comes from another part of the world.
It does. It does.
I really like blueberries. Okay, and and I eat a lot of fruit, and it just but some of it just isn't very good. But the blueberries that we're currently purchasing from a local store are just excellent. Are they bad for me or good for me?
Well, it's going to depend. That question is going to depend. Are they organic or are they regular?
There is a gentleman. Now, of course, we can't get any from around here right now.
Right.
But there is a fellow in one of the cities where we have a store that his are all natural, all whatever, they are out of sight. And I buy them, freeze them, and eat them like candy in the winter months, you know, frozen stuff like that. So, but those and some of the other veggies that we can get locally. It's very interesting the farming around us here. You know, the fields, and are we gonna have you're not the right person to ask this, but it looks to me like I got flowers already growing coming out of my house. Are we gonna have Are we gonna have 2 crops of food here, you know, for the farmers this year, because it's so, you know, stuff's growing.
Well, and every year that becomes questioned because of the
Yeah.
change in our seasons for sure. And to
Yeah.
answer your question about those blueberries, the best thing I would say to you is talk to where you're buying them. That's the best thing I would always say is have a conversation with the folks that you're purchasing from, especially if it's somebody that is carrying local produce. Those farmers
Yeah.
are so proud of what they're doing. They want to share with you how
Yeah.
they're growing their crops and the effort they put into it and the money and the time and the energy. So have those conversations for sure and continue to
Okay.
support that. Yeah.
Okay. I guess it's time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to our pharmacist about our Health Matters membership savings program. We want to help you stay well and save money. We were kind of batting this around before the break. How about this? What are sources for finding local produce and proteins if your grocery stores are not carrying local?
So one of the best things you can do is hop online to ohioproud.org. And that's a great website to give you some local farming that you can start to reach out to and participate in. There's also another website that I found useful is www.mcmichaelchiropractic.com. On their website, there's a tab called Local Healthy that lists all of the local farming in the Stark County and Summit County areas. So pick your own fruits and vegetables, or you can certainly stop by the markets and buy pre-picked. We're talking about also fresh beef, chicken, eggs, pork. So when you can't find things that are local in your grocery store, there's always opportunities that surround us, even in the winter months that we can access. And certainly using those in the summertime and then doing your best to put a little bit back for the winter is always an excellent practice to maintain as well.
Okay, so why is it important to shop local, and what are the impacts? And I have one mini story. My father-in-law, who's passed away, used to grow potatoes and some other things, and his potatoes were just fabulous compared to those you get from the other part of the country. And they picked them 6 months ago or something like that. But we really love those potatoes. I don't know, potatoes good for you?
They are. They are.
Okay.
There's nothing wrong with potatoes. It's what we do with them that's the problem.
Yeah, that's right. Fry 'em. Okay.
But
Okay.
honestly, the impact on why we're shopping locally is there's several things. You talked about one very important aspect is the flavor. Let's face it, when we grow our own produce, even in our own backyard, first of all, the value of the effort we put in certainly makes it taste better, but the flavor is so much better. The nutrient density is honestly better when we are buying it fresh and local. The other component to that is the pesticides that are used when we are purchasing food that's coming from, like you had mentioned, overseas, different locations where they're just kind of shipping it into us, and they're shipping it in not ripened and actually providing, if you will, like a gas will to increase or expedite the ripening process. So by the time we get that produce, it is a little bit devalued in its nutritional content, and certainly the flavor is not what we're used to when we buy fresh and buy local. And of course, I'll go back to, supporting your local farms. Every time you buy local, you're supporting the local community and continuing to help that process.
For sure.
Okay, Tori, what does eating in season mean, and what's the overall value of this?
So eating in season is when we are choosing and eating produce that's at its harvest peak. So for our area, what fruits and vegetables are growing in this area during the spring or summertime? Reasons for this is because they're more flavorful. Like Paul said, those potatoes were tasted better than store-bought ones. They're also more nutritious. So when you're buying produce out of season, it's getting shipped in from another area. And so during its time to get to our stores, it's losing flavor and nutrients. But also just like we as individuals crave the seasons changing. When it's winter, we want summer. Our bodies also crave specific nutrients at different times during the year. For example, during the summer months, when we are outside in the sun, our bodies are craving more fluids, those lighter produce like watermelon. I mean, during the summer months, I know I'm eating watermelon a lot more than during the winter months. It's just listening to our bodies and adapting to the environment.
Well, doesn't that go along with the hunter-gatherer type philosophy that hundreds or thousands of years ago, you couldn't get strawberries in dead winter. You ate what was there, or you hunted it and ate what was there. So it does make sense that you would have a cycle of different offerings throughout the year. We're just a little spoiled by having almost whatever we want when we want based on what we can afford. So, but what about other impacts on overall health with eating local?
So one, shopping local, it allows you to know your farmers, have conversations with them to know what is the process of how this farm or this food is getting to your table. And then Joy also mentioned earlier that you get to understand the process they're going through and their time frame for growing this produce. It can also cut down on pesticides and chemicals entering into our body. When you know where the food is coming from, you can choose those farms that might not be using that. You're more likely to cut out processed food when you have those or items in your household. You're not going to be going to the store to buy prepackaged foods. And then all of these locally sourced foods, they feed our microbiome.
Okay. What about gut integrity? Is there any difference based on the regional choices of what food you would eat there?
Absolutely. So our gut is what our overall health stems from our gut. And so we have to keep our gut healthy. And when we're shopping local, we are able to get polyphenols from fruits and vegetables, and those make up the different colors of the foods. And so our gut requires those because it feeds the bacteria in our gut, which helps it flourish. And when our gut bacteria is flourishing, it's impacting our overall health.
It is important to maintain your healthy gut because it's very important in your immune system. And we could have a whole program just on talking about gut health. So that's something to think about going forward because people probably aren't thinking about that. So, Joy, let's talk about navigating the grocery store. This is one of my favorite topics, actually. So I have comments when you're done. But what tips do you have to share with our listeners about the important concepts of grocery shopping?
There are so many, so I'll try to condense this. But going back to the same ritualistic type of suggestion that you hear all the time, which is shop the perimeter. When you shop the perimeter, you start with the produce section. And if anyone notices, typically the produce section is sort of usually the beginning stage of the grocery store for a reason, because of all of the color. It's very stimulating to the eye. It's stimulating to the consumer. Well, it's also so important and so valuable for your body. So filling up your grocery cart with fruits and veggies first, hopefully focusing on organic when able, especially those that what we call, there's something called the clean 15 and dirty dozen. So the clean 15, those are the fruits and vegetables that we can actually buy, not organic, because we can peel off the outside, bananas, oranges, sometimes potatoes, but oftentimes we'd like you to keep the skin on the potatoes. And then the dirty dozen would be things like fresh berries or things that we're going to quickly ready to eat. So as you go through the perimeter of the grocery store, continue to focus on fresh whole foods as much as possible. Like you mentioned, the hunter-gatherer, that's the concepts that we bring home all the time. How can you eat as close to the earth as possible? So when you're in the grocery store, trying to avoid a heavy amount of in between the aisles with processed foods and focusing on fresh as much as possible. Look at your ingredients too. The ingredients matter. The longer the list, if you have to start Googling those ingredient lists, you want to maybe step away from some of those food choices.
It is an interesting experience. For years, my wife took care of all the grocery shopping, and then she had an incident where she broke her leg, and I got to do a lot more things than I had for a long time. But it is a fascinating experience. It's easy to say shop the perimeter, but you can go in and be intimidated, and what looks easy is often the cheapest, but it's got the most junk in it. So you almost need to take some time to educate yourself on what's there. And
You're exactly right.
And especially before the program began, for the listeners' benefit, we were talking about how expensive it's gotten to eat out. So, there's a lot of value in preparing your own food and having some leftovers and taking them for lunch the next day or two. So don't be afraid to talk to one of the dietitians on the program if possible. And, you might not only save yourself some money, but improve your quality of life by getting a lot better nutrition in the process. Nutrition doesn't have to
Absolutely.
be a bad word. So
Thank you. We agree.
We have all done it. Bought too much. And then we have food waste. What do you advise to reduce food waste and while eating healthy on a budget? And we used to spend $160 a week buying the same stuff now, just $240 a week.
Mhm.
And
It's tough.
and so our refrigerator now looks like we don't live there anymore. And that's because my wife is buying a little bit more frugally. We don't buy a
Mhm.
gallon of milk. We get a half a gallon, those sort of things. So we try to, I guess we're trying to minimize the waste. But one quick thing, how about frozen food? Is any of it any good?
Some of it is good. Frozen vegetables, frozen fruits, those are places that you can absolutely do. And that helps you so that if you buy a little bit of fresh, you don't want to buy too much so that it doesn't go to waste, opt into your frozens at the end of the week.
Okay. It is the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Yes, you are listening to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning, we're talking to dietitians Joy Benjamin and Tori Hargett. So we were kind of kicking this around, I guess, before the break. Okay, so we've all done it. We bought too much food. We have food waste. What do you advise to reduce food waste while eating healthy on a budget?
Make a list first before you head to the grocery
Oh,
store.
you have to make a list, huh?
You have to make a list. Take
Yeah,
a quick inventory.
but you're going through the grocery. Hey, that's wonderful. I'm going to get that too. So you
And
go
that's
out.
what we do.
So you go out the door with an extra bag of stuff, and
Who
then
doesn't do it?
you don't eat it all.
Mm-hmm. And that's the truth. If we can try to stick to a list as much as possible, that will help. Pay attention to the ads before you make your menu for the week or together your ideas for the week. What's on sale, first of all?
Mm-hmm.
What is your family going to use? We know what our schedule's like, so pay attention to that. Use leftovers for lunch the next day or for the evening, the next night. Buy fresh is something we mentioned in the beginning. Buy fresh to get you through the first part of your week, and then rely on your frozens, especially fruits and veggies, towards the end of the week so that you don't waste and throw away. Pop things into the freezer. If you see them going bad, don't just throw them away. Pop them in the freezer and use them for a later meal. There's all kind of different ways we can go about it.
Social media has made meal prepping a new trend. What are some of the simple steps to start meal prepping?
Meal prepping does not have to be intensely involved and take hours, without a doubt. But pay attention to what your schedule is for the week. Know what days you're going to have time to cook and not. Maybe cook in bulk. Instead of making just one meal, double the recipe so that you have it for leftovers the next day. Another option is buy pre-cut things at the grocery store to save yourself time. Make one pot of a grain or a potato and then use a bunch of pre-cut veggies to saute or cook. And then you've got a nice combination put together, and all you need is a protein to combine into that meal. It doesn't have to be involved. Instapots work wonderfully. So do crock pots. So does sheet pan cooking, where you throw everything on the sheet pan, pop it in the oven for 20 to 30 minutes, and your dinner is made for you. So we really want to just focus on simplifying meal prep rather than making it a very involved process.
So, Tori, share some tips on reducing processed foods and cooking more at home.
So the first step to cutting processed food out is identifying the processed food you have in your household. So going through your pantry, going through your freezer and fridge, and identifying those items. Cutting it out, cooking more at home, it is going to take more planning, like Joy said, but if you can plan out your week, it's more likely to happen. Look at snacks that you're eating. That is where a lot of the processed food comes into our diet, is snacking. And if you can replace those snacks with fresh or fruits and vegetables, nuts and seeds, those have so many nutrients for our body and are a healthier alternative. I tell people, if you have a sweet tooth, go for fruit. If you want something crunchy, go for some vegetables or nuts and seeds. Always a great replacement. And then just having certain ingredients in your household to allow you to cook at home. So fresh herbs, seasonings, and not those prepackaged seasonings, the individual ones like garlic powder, paprika, chili powder, and then citrus flavors are all good options to help limit the processed food in your pantries and cook more at home.
Well, why don't we take that a step further? Because I'm thinking, we're talking about meal prep and shopping at the grocery and being intimidated by all the options. What's a garden variety staples list, if you will, to keep in your home, in your fridge or your pantry for maybe eating a little bit better, healthy, and more quality meals?
Absolutely. That's a really good question. Seasonings are number one. Easiest way to flavor foods. And so having those dry seasonings where you can make your own mixture. Google and Pinterest are great options to look up Italian seasonings, taco seasonings that you can make by yourself. You don't have to buy those prepackaged. Having fresh potatoes, yams, or squash in your house. Explore ancient grains. Those are a great way to get healthy grains in your diet. And these can include quinoa, oats, millet, farro. There's a whole list of them, but experiment with different foods like that. Finding a good bone broth for flavoring or adding to your soups if you're a soup person. And then making sure you always have dried or canned beans and lentils on hand in your pantry. Always a great protein option, or just kind of a filler if you want some more added to your meal. Those are the top ones I would recommend.
All right. So you made me think of something when you were talking about herbs and seasonings. So I have to ask this question, or maybe an opinion on a question or a comment. So one of the things that fascinated me is I have an acquaintance who copiously puts salt on their salads. And I guess I'm just thinking, is there any room here in the discussion to talk about certain seasonings in moderation at the risk of being in excess?
Absolutely, there is. When you look at seasoning, the first thing you want to do is, again, take a look at the ingredient. If it's just a basic level seasoning, like Tori was mentioning, garlic, onion, different herbs and spices, but when it becomes a blend, that's when we have to be cautious. Salt is good for us in small doses, but we get enough salt from processed foods that we should not be using a lot in our seasoning at all. And so we have to be cautious and more cognizant of how much we're taking in. The average person needs about 2,300 milligrams of salt a day. So that's roughly a teaspoon of salt. We can take that in very easy ways through processed food. But if you're looking at those seasoning blends, look for the word sugar, look for the word salt in there. And you really want to consider, like Tori said, Google those recipes. We can make those so simply and so much less expensive by just looking at Google for a quick blend to put together, and then keep that in a Ziploc bag in your pantry, and you've got it to use for the next time you make something.
Okay, very good.
Wow.
Well, how about this? Community. Dinner together is an integral part of many families and roommates. Is there value to eating with others versus eating alone?
Absolutely. As humans, it was designed for eating to be in a community, and there's a lot of benefits to eating with others versus alone. Not only it can be a great stress reliever. So if having that social interaction can release stress. We tend to make healthier choices when we're sitting next to someone versus ourselves. And so and then that physical connection can help promote digestion. And so I tell people, if you're not already, make family dinners a priority. If you're at work for lunch, sit with your coworkers and talk to them during lunch instead of sitting at your computer continuing to work while you're trying to eat too. If you don't live with someone and you have a pet, consider eating with your pet. It's still a physical connection that will improve your mental health and your physical
Oh,
health.
wait a minute. You want the pet sitting beside you at the table or what?
I don't know. My dog's just staring stares at me. So
Oh my God. Okay. All right. Interesting.
All right. Well, why don't we touch on nutrition also? I mean, if we do the best we can to eat whole foods and get them in our diet, I wonder what your opinion is on, additional supplementation with other vitamins and minerals and nutrients. And I guess, we already commented at the beginning of the show how often we get things that are mass farmed from all over the world and shipped in. So what exactly is a tomato today versus a tomato maybe 15 years ago like?
This is a really good question. I like this. I like where this is going. It is a lot different. Our soil content, because of the way that we have turned to industrialized farming, the soil content is changing. And so as a result, we're seeing less absorption and less availability of vitamins and minerals, and specifically minerals from our soil. And so buying from the grocery store, we think that this is our best option, right? And that is really what's available to us. But it's important that we start considering the volume that we are not receiving of vitamins and minerals, not just from the produce, but from folks who just aren't getting enough in their diet. So I didn't used to recommend multivitamins as an automatic, but more and more today, as we assess people's diet and their intake, we are finding that a multivitamin might be one of the most supportive things they can do. And we love to suggest whole food-based supplements for sure, especially when it comes to the absorption of the vitamin into the gut. The other vitamin that I always suggest is a vitamin D. In our state of Ohio, we don't get enough sunshine, and that's the number one place that our bodies will absorb the sun, vitamin D. So unfortunately, we really need to support that through the winter months.
Interesting. Our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Pharmacist Brad White, and I thank you for joining us. We have a very interesting program today. So let's get back to the last segment of the show. Yeah, I think we covered this supplement, suggested supplements to enrich a healthy diet. I mean, there are people out there that are taking a mountain of stuff. And are some of these supplements a problem that some of these people are taking compared to just the basic, multivitamin, maybe some D, and one or two others?
Well, what we have found overall is that when you talk to folks that are taking volumes of supplements, sometimes they are double dosing, if you will. And so we kind of work through that with them and show them that some of their different vitamin strategies might have the same vitamin or mineral content. And so they're actually wasting some of their money. So that's an aspect that we talk about when we talk about their diet. There's a lot of different herbal supplements that folks can be using. The one thing that we encourage is that they have a conversation with their physician about any medication interactions that could be taking place with any mineral supplementation or specifically herbal supplementation. So we try to minimize the volume folks are taking in. Certainly there are needs of some of these supplements. For instance, if they need an iron supplement because they have a certain condition, or they might need additional vitamin C to help support their immune system at certain times of the year. So we kind of navigate the waters determining, and it's very individualized, but yes, you're not wrong. There are some folks who are taking volumes that maybe could be minimized.
So Joy, you have shared so many great healthy ideas today. What do you hope our listeners will take away from your conversation and our conversation today? My
hope is that folks start to recognize the value of eating whole food again. We have become such a processed food society, and our food system has become so industrialized that it's actually harming our health rather than helping it. Food can be the center of your health if you allow it to be. And if you prioritize and make cooking at home a priority again, I think that oftentimes time becomes the concern that most folks express. But when we have control of our own time, we can manipulate that so that we have the space to cook more at home, cook more whole foods at home, less processed, less takeout. And the center of our health, which is our gut microbiome, will be better for it in the end.
Tori, why don't you share with our listeners where they can find more information about nutrition with AultCare? And I guess I'd also like you to add too, I think that when we have patients in the pharmacy, they often don't know how to access a dietitian or what value they can bring. And I think you gave quite a bit of background today on from both of you on how you can, but I think it might be helpful if there's other modalities that people can reach out through the AultCare system.
Yeah, so if they go to altcare.com, at the top right, there is a members resource tab. On that, they'll just hit the health and wellness and then scroll down to the wellness tab, and that's where they can find more information on nutrition with AultCare.
Does it normally require a physician referral? Do you know?
To receive information from a dietitian?
Yeah.
So there's two ways that can happen. Their doctor can recommend or write an order for dietitian consultation, and then they can go through the hospital or their local hospital for the outpatient dietitian. If they're an AultCare member and they need information, they can contact the service center and ask to speak to a dietitian. They'll be connected with one of us at AultCare.
Okay. All right. I think that's helpful.
Some time ago, another dietitian suggested in the meeting that I was in that she take us shopping to the grocery store. I'm thinking, and she said that, okay, you're not going to make me buy squash, are you? And some of this, no, she said, I'm just going to make sure you shop and we all buy nutritional products and not snacks and all that kind of stuff. Well, we never did really put that event together, but I've been thinking that would be something to really be interesting to do.
We've actually hosted grocery shopping tours with AultCare in the past, and we have a video currently that we made at a local grocery store. It's a grocery shopping tour that really takes you through the store and talks about some of the things we didn't get to share necessarily today, but a lot of detail about how to navigate the grocery store if you're looking for better options to feed your family. So yes, we have that option.
I would like to do that. That's really good. I didn't do it with this other lady. With this other meeting, it just didn't fit. So, but if you could let us know on an event like that, that might be very interesting. Okay.
I was going to say soup is a great way to get some variety in, especially if you're using a bone broth soup. Bone broth based will cut down on the sodium for any folks who need to watch their sodium intake. That's a great way to do it. But you can throw all kinds of different veggies and proteins into soups. Grate it however you want it.
Okay. I think
all right, Tori, why don't you give us your last words of wisdom on how to live a local healthy life?
All right, so just take small steps. Changing our eating habits can be very overwhelming. It's not a simple task because typically we have been eating the same way since we were taught. We learned from our parents, our siblings, our grandparents. And so just focusing on one part of your lifestyle at a time and making changes individually. This can allow it to be sustained over a long period of time instead of doing it all at once, feeling overwhelmed and just quitting in the end. We want this to be long-term, not just temporary. So just focus on small steps.
Joy, how about you? Your final message.
Just continue to do the things that you know to be right. When you're doing your grocery shopping, when you're thinking about your meal prepping, adding good things in. Sometimes we focus too much on taking away. Start focusing on what can I add in to support my diet. And sometimes when you do that, it doesn't leave enough space for some of those things that we're trying to get rid of, if you will. So I always encourage focus on the positive, focus on what I can put in there rather than what I have to take away.
Wow. Okay, I think we're out of time. Thank you to our guests, Joy Benjamin and Tori Hargett, dietitians at AultCare. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health Systems and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here next Friday on News Talk 1480 WHBC. Thank you very much, ladies. It was really very good.
Thank you for having us.
Thank you very much.
Yes.
Thank you for having us.